We've been hearing more and more about how much our health and ability to lose weight is impacted by our GI tract or gut. This pathway is responsible for processing our food and all the nutrients in it. It's also where almost 80% of our immune system operates and has been connected to many functions for health as well as mental health. However, there is recently coined condition called leaky gut syndrome that refers to gaps in our intestinal wall that can let substances into our bloodstream. It may impact IBS, IBD, Crohn's disease, the immune system, skin health, fatigue, as well as a host of other ailments. A leaky gut syndrome is not an official diagnosis, but often refers to the normal intestinal permeability that we all experience. There are tight junctions and gaps that allow substances like water and nutrients to flow through into the bloodstream. However, in some individuals, the permeability may be worsened and lead to other symptoms like bloating, cramps, gas, food sensitivities, as well as pain. What causes leaky gut syndrome? Little is known about what specifically causes leaky gut, but has been gaining interest in the medical community. A leaky gut is usually indicative of another health problem. For example, we know that an increase in intestinal permeability often comes along with type 1 diabetes and celiac disease. Additionally, studies have found that when there are higher levels of a certain protein, zonulin, there is more permeability and looser junctions. Two things can increase zonulin levels in an individual: bacteria and gluten. In people without celiac disease or gluten allergies, the research on gluten's impact on zonulin levels is mixed. But we do know that low levels of the good bacteria in our gut have been linked to a multitude of health issues. We also know that alcohol, certain medications, antibiotics, and painkillers, as well as certain health conditions, can impact a healthy gut and create an imbalance of healthy versus unhealthy bacteria. Studies have also found that people who have chronic stress lifestyles are more prone to have leaky gut. Leaky gut syndrome symptoms and factors. As a leaky gut is not a formal medical diagnosis, it is seen as more of a description of other issues that have been linked to a more permeable gut. So, what are the symptoms of a leaky gut? There are some symptoms and signs of a leaky gut, but factors tied to intestinal permeability as well as other things that can contribute to discomfort. Digestive diseases. If you suffer from celiac disease or other inflammatory bowel diseases like ulcerative colitis or Crohn's disease, treating the actual condition will make the most improvement. But it has been shown that these digestive conditions do lead to increased gut permeability. It's unclear how the disease and leaky gut influence one another, but following the advice of your medical team and eating a healthy diet will likely improve symptoms like gas, bloating, and constipation. If you suffer from celiac disease, it is important that you eat a gluten-free diet. Diarrhea. Similarly, if you suffer from chronic or recurrent diarrhea, it may be a sign of a leaky gut. Irritants and toxins in the bloodstream come into contact with the intestinal wall and may lead to inflammation, increased gut permeability, and a reaction of trying to empty the bowels quickly. Left untreated, this can lead to a more serious condition. Brain fog. Like the leaky gut, brain fog is not a medical condition or formal diagnosis, but rather a set of symptoms from other medical conditions. Brain fog refers to memory problems, poor concentration, inability to focus, and lack of mental clarity. It can often interfere with work or studies. Some believe that a leaky gut can contribute to brain fog through the gut-brain axis. Some research has pointed to a connection between migraines and IBS. It's important to talk to your doctor or medical team to rule out any underlying health medical reasons for brain fog, such as side effects from medications. Constipation. If you struggle with chronic constipation, you may also have a leaky gut. The toxins present in the stool may irritate the lining of the intestines, leading to inflammation, intestinal tissues, and increased gut permeability. If left untreated, this may also contribute to irritable bowel syndrome or disease. Joint pain. Joint stiffness and pain may be tied to leaky gut. Certain kinds of arthritis, like psoriatic arthritis, are associated with an increased risk of ulcerative colitis and Crohn's disease. These are all inflammatory autoimmune diseases. Eating a healthy diet can help heal the gut and may also improve these other conditions, including joint pain. Skin issues. If some harmful substances are crossing through the tight junctions of your intestinal lining, the resulting inflammation can aggravate certain skin conditions. If you have noticed a worsening in acne, rosacea, or eczema, you may want to try eating a healthy diet that promotes gut healing to see if these conditions improve. Autoimmune disease. Many autoimmune issues have been associated with issues with the gut microbiome and gut health. In fact, recently more evidence has found regarding dysfunction with the intestinal barrier and autoimmune disorders such as type 1 diabetes, rheumatoid and psoriatic arthritis, psoriasis, celiac disease, multiple sclerosis, and more. Since so much of our immune response is modulated in the gut, Proper intestinal health makes sense for helping with autoimmune disorders. Remember, these are often chronic diseases that have no cure but can be managed with proper medication, nutrition, exercise, and lifestyle. Irritable bowel disease, or IBD. Irritable bowel syndrome, or IBS, is a common disorder that is not particularly well understood. Chronic fatigue. Patients who suffer from chronic fatigue syndrome may also have leaky gut. Research has shown that patients with chronic fatigue syndrome had markers of inflammation in their blood, which may be the result of leaky gut. If you suffer from chronic fatigue, fibromyalgia, or other pain or fatigue ailments, make sure to talk to your practitioner about your diet and gut health. Recent scientific studies have shown that IBS patients do have increased intestinal permeability or leaky gut. They found that patients with more gut permeability also had more severe IBS symptoms. Working with a doctor or dietitian on a diet to heal a leaky gut may improve IBS symptoms. Irritable bowel disease, or IBD, refers to more serious conditions like Crohn's disease and ulcerative colitis. These conditions are also autoimmune diseases. Recent studies have shown that having a healthy gut can improve these conditions and their symptoms. Nutrient deficiencies. A leaky gut may lead to nutrient deficiencies. As the gut is inflamed, there is more permeability and certain nutrients may not be absorbed and processed efficiently. Common nutrient deficiencies include vitamin B12 deficiency, iron deficiency, and magnesium deficiency. These can lead to chronic fatigue as well as nerve and muscle pain. Food allergies and sensitivities. It is also now thought that a leaky gut may contribute to some food allergies and sensitivities. Food allergies may cause irritation or inflammation in the intestines and lead to increased gut permeability. If you suspect you may be suffering from this, it is best to work with an allergist or dietitian who specializes in food allergies to remove the foods from your diet and give your body a chance to heal. Medications like ibuprofen and Motrin. If you regularly take non-steroidal anti-inflammatory drugs or NSAIDs like ibuprofen, aspirin, or acetaminophen, you may also have leaky gut. Research has shown that patients who use these medications long-term have increased intestinal permeability and higher levels of inflammatory mediators in their blood. These drugs are common over-the-counter pain relievers like Motrin, Advil, Tylenol, and more. Talk with your doctor about using these for an extended period of time and make sure you eat a healthy diet that will heal your gut. If you think you have leaky gut, try this. Eat healing foods. Eating a healthy diet is the key to improving gut health and fixing a leaky gut. Remember, nothing is ever gained by eating a poor diet. Foods that work as prebiotics and probiotics can help with intestinal barrier health. Make sure your diet regularly includes the following foods: vegetables like kale, cabbage, broccoli, Brussels sprouts, arugula, beets, spinach, ginger, mushrooms, and zucchini. Roots and tubers: potatoes, sweet potatoes, yams, carrots, winter squash, and turnips. Fermented foods: sauerkraut, kimchi, tempeh, miso, kombucha. Fruit: grapes, bananas, blueberries, raspberries, strawberries, kiwi, pineapple, oranges, mandarin, lemon, limes, passion fruit, and papaya. Sprouted seeds: chia seeds, flax seeds, sunflower seeds, and more. Gluten-free grains like rice, oatmeal, buckwheat, and amaranth. Healthy fats like avocado, avocado oil, coconut oil, and olive oil. Fish like salmon, tuna, herring, and other omega-3 rich fatty fish. Meats and eggs: lean cuts of chicken, beef, lamb, turkey, and eggs. Herbs and spices: all herbs and spices. Cultured or fermented dairy products like kefir, yogurt, Greek yogurt, which contain probiotics. Nuts: all nuts, but try them raw or slightly roasted. And reduce stress. Find a way to regularly decrease your stress levels in a healthy way. Talking with friends, picking up a new hobby, listening to music, or reading may help take your mind off of stressors of daily life. Get some sleep. Good quality sleep is important for overall health and for healing the gut. The body normally repairs and restores itself during good sleep, so make sure you have a good sleep routine. Try using dim lights in the evenings, limit mobile devices and screens, and sleep in a cool, dark room. Exercise. Regularly moving your body is important for all facets of health. Find a physical activity that you enjoy and can do regularly, from dance to walking to swimming. Exercise can help regulate gut movement or motility and also aids in the body in removing excess waste through sweat. While there is still not an official medical diagnosis, leaky gut syndrome is becoming more and more recognized by healthcare practitioners. Research is also understanding the role that leaks in the intestinal wall may play in a wide variety of health conditions and chronic diseases. We now see research emerging that increased intestinal permeability may make certain symptoms worse. If you're struggling with digestive health conditions, it is best to see a gastroenterologist. Along with the dietitian, they can help repair intestinal barrier function through treatment, diet, and lifestyle. But you, watching this video, are doing a great job by educating yourself and striving for a healthier gut. Thanks for watching. Subscribe for more tips.